All right, so we're trying to look at the signs and symptoms of heart failure, but our channel will kind of like deal with children issues. Do you understand? But we had to also talk about the adult one because it's good that you know how this same disease condition can affect adults and how it can be able to affect children at different ranges. Okay, so clinical features of heart failure in children and adults, right? So these infants and young children, then older children and adolescents. All right, what you see on what chest examinations and all of that. Okay, so let's discuss them. So it's just all about listing. Maybe if you hear a new word that you don't really know what it means, you can just comment out, hey, what is this word, and I'll explain it to you. So in infants and young children, they're having tachypnea, that's difficulties in breathing, feeding difficulties, diaphoresis, they are sweating most of the times when they eat. Okay, pallor, the skin is becoming kind of like whitish. Okay, failure to thrive, they are not growing that much again. Cyanosis, oxygen delivery to tissues of the body is not sufficient again, so their skin is becoming bluish. Okay, palpitations, the heart is working faster than normal. All right, so facial and dependent edema, so on the face, on the lower extremities, you have like accumulation of fluid there. All right, so please pause this image to observe it. Right, so in older children and adolescents, they easily get tired, they sweat, difficulties in breathing. When they lie down, there's difficulties in breathing, that's orthopnea, abdominal pain, nausea and vomiting, palpitations, chest pains, dependent edema, ascites, cool extremities. Okay, so on chest examination, there's a whole lot of crepitations, a whole lot of what sounds. Then cardiovascular examination, the heart is beating too fast. Pulse could actually vary. The pulse could be low, the pulse could be normal, the pulse could be too full. All right, displaced apex too, showing you that what the heart, the tip of the heart, that means the whole left ventricle actually got so large that the tip of the heart is going out of the normal position it should be at. Gallop rhythms, murmurs, having extra sounds in the heart, raised jugular venous pressure, tender hepatomegaly, then a swollen stomach, that's ascites. So alright, it's just trying to talk about the whole symptoms again. Alright, so that's what you can actually pick up in children, in infants and adults. Okay, if they have heart failure.